Local health authorities and the government have emphasized that the impact of violence extends beyond families and communities, adversely affecting the operations of health facilities. Health Minister Honorable Moses Jabatis highlighted the strain on medical staff who must attend to patients waiting for care in the Accident and Emergency Department, often delayed due to urgent cases stemming from gun violence injuries. He noted that this situation creates a backlog and, worse still, affects the mental wellness of healthcare professionals. Honorable Jabatis made these remarks while responding to a reporter's question outside Parliament on Tuesday, June 18th.
What is the government doing? I think it's a global strategy, it's a national strategy to combat crime in the first place, because this is really the core and the source of that stress we're seeing at the hospitals and on our medical professionals. So that is the first thing. But secondly, in increasing security, we have a wonderful relationship with the St. Lucia Police Force, and whenever there's an upsurge or a flare-up, you can see the police, jumping into action right away, going to our medical facilities. It happened with the St. Jude Hospital also. When there's a flare-up in the south, the police comes to our aid right away.
The minister also underscored the strain on the St. Lucia Fire Service. Jabatis added that to further compound the situation, there are serious challenges related to non-communicable diseases and an increase in hospital admissions.
For the St. Jude Hospital, for example, this year over last year, we have a 294% increase in bed occupancy. 294%. The St. Jude Hospital, there are 50 beds, and 294% increase in occupancy. At the Owen EU Hospital, the occupancy is, the admissions there are going over 100% over last year. We are seeing at least 26% of that because people have issues with non-communicable diseases.
He mentions that the OKEU Hospital currently has 120 beds, whereas the Victoria Hospital had more beds. Consequently, arrangements have been made to accommodate the influx of patients requiring care.
At the Victoria Hospital, we have opened the secondary care hospital, which eventually will see another 31 beds. So we're going to add, over time, 31 beds to the 120 beds we have at OKEU, and we are going to add other services. We have added other services at the secondary care hospital, and we are doing some more work at the Victoria Hospital to relieve the pressure, the Castries Wellness Center and so on. We are doing work on the Cuban Eye Care Clinic. This work is almost complete. We are going to see the pressure being lessened at the wellness centers, and we're going to have a state-of-the-art facility with a brand new operating theater.
The government is currently expanding certain areas at St. Jude's Hospital, located at the George Odlum Stadium, to increase bed capacity. The hospital is expected to expand from 50 to 66 beds, as St. Lucians eagerly await the completion of its refurbishment.
At the newly refurbished St. Jude Hospital, we are going to have more beds than we currently have. We're going to have at least 96 beds to start with. And these are just regular inpatient beds. We're not speaking about emergency and so on. So what is happening now? The hospitals now, because of the increase in the number of admissions, they now have to use the other beds that are not the regular inpatient beds. They have to use the regular census beds. They have to use the emergency beds. They have to use, even in some cases, going into ICU and so on. So that is our issue.
He emphasizes that the issue is not just confined to hospitals, but affects the entire country. The minister highlights a 34% increase in individuals suffering from hypertension over the past year, with patients exhibiting signs of lifestyle-related diseases. Shane Stephen, NBC Prime.